I'm Professor Harrow, and what we're going to do today is do an actual checkoff, demonstrate what your checkoff is going to look like when you come to campus to perform it. Remember, before each checkoff you want to wash your hands. I did that around the corner, so you want to wash your hands or use some foam in or foam out. You're going to want to provide for privacy, so in the lab that's going to be drawing the curtains. If you're in an exam room, you'll just have to shut the door. You're going to want to gather all of your equipment, and I will go over that in the beginning part of each of the checkoff, but you want to make sure that you have everything that you need so that you don't have to leave the room in the middle of an exam to go get something. You also want to make sure that you use your stethoscope correctly, and that includes when you're ready to use your stethoscope that you use the alcohol to clean the earpieces and the diaphragm and the bell, and that when you're using your stethoscope that you've got your fingers here and you've got your stethoscope against the skin like this so that you get a nice clear sound from your stethoscope. And because this is a checkoff, you're going to need to talk through it. I'm not going to know what you hear unless you tell me. So you're going to have to describe what you're doing with words like, first I'm going to inspect, then I'm going to palpate. I'm going to palpate for masses or for lesions. Next I'm going to percuss. I hear resonance when I'm percussing over the lungs. We've demonstrated this before, but remember your percussion here on a bone is dull and here on the lungs is resonant, so you're going to have to tell me what you hear that way. And when you do things like auscultation, you're going to have to say there are no adventitious sounds, the lungs are clear to auscultation bilaterally, or I hear some congestion, I hear some wheezing. If you hear something abnormal, you're going to want to describe it. So talk your way through it as you go, and that will help you hit all of the high points as well. Good luck. So I'm getting ready for my checkoff for health assessment, and the first thing I have to do is wash my hands, which I've already done. I'm provided for privacy here in the lab with the curtains closed as much as possible, and I've gathered my equipment. I don't know what I'm going to choose for my checkoff system, so I'm just going to get everything I need. So for lungs and thorax, all I need is a stethoscope. I'm going to need some tape for diaphragmatic excursion and something to measure with. For cardiac, I'm going to need a measuring stick and a straight edge to do jugular pressure, elevation, and my stethoscope. And then when I get to peripheral vascular, I'm going to need a measuring tape for the calf circumference. If I get skin, hair, and nails, I really don't need anything, but I have a ruler if I need to measure something. For head, neck, and regional lymphatics, I don't need anything except for my hands and my stethoscope to be able to listen for a breathe for the thyroid. For eyes, I have something for cover, uncover. I have a pen light. I have my card to estimate pupil size, and I have my ophthalmoscope on the wall. That's all I need for eyes, I think. For ears, I have the otoscope on the wall. For nose, mouth, and throat, I have a pen light for transillumination. I might need some gauze. I have a couple tongue depressors. Let me see if there's any gauze over here. Well, if I draw that, my handy assistant will have to help me. Here we go. Here's some gauze. I have a whole package. For ear, nose, mouth, and throat. For abdomen, I don't need anything but my stethoscope. I'll need a measuring tape for the liver span. For musculoskeletal, I don't need anything. And for neuro, which I hope I don't get, I have scents for the olfactory. I have my reflex hammer and a tuning fork. I have cotton. I have some items for stereoagnosis. I have some things for sharp and dull, and so I think I'm good to go. Okay, Megan, nice to meet you. I'm Kathy. I'm here today to do your health assessment, and I'm going to start with your lungs and thorax. So I'm just going to move over this way. And first I'm going to identify some landmarks. My hands are a little cold. I apologize for that. Okay, so here is her trachea, which is midline. Her suprasternal notch coming down her angle of Louis and going out this way, her second rib. This is her sternum, so this is her mid-sternal line. Here are her clavicles, so her mid-clavicular lines. This is the mid-axillary line with the anterior and the posterior axillary lines. On the back here are her scapula, so these are the scapular lines, and here is the vertebral lines. Back this way. On the front, on her right side, she has an upper, a middle, and a lower lobe. On the left, she has an upper and a lower lobe, and on her back, she has just upper and lower on both sides. So first I'm going to start with inspection, and I'm just looking at how she's sitting. She's sitting upright. She's breathing easily. Her breasts are not labored. When I look at her chest, her transverse diameter is twice what her anterior-posterior diameter is, and her chest is a nice elliptical shape. She doesn't have any overdevelopment of her neck or trapezius muscles from breathing heavily. Her color is good. She's not cyanotic at all. Her level of consciousness is good. She's able to follow instructions. The angle of her ribs, on the front, right here, take a nice big deep breath. I'm doing expansion here too. But the angle of her ribs in the front is 90 degrees with symmetrical expansion, and the angle of her ribs, take a deep breath, in the back is 45 degrees with this vertebral line there, and with symmetric expansion. Hope I got everything there. Okay, now I'm ready for the rest of my palpation. I already did symmetric expansion, so you're just going to feel my hand on your chest, and every time I move, if you would just say 99.
99, 99, 99, 99, 99, 99.
Thank you. And then on the back.
99, 99, 99, 99, 99, 99.
And those are symmetric. I'm just going to stay on the back here. So I finished my palpation piece, so I'm going to go on to percussion next. And I'm going to go ahead and use the reflex hammer so it makes my percussion notes a little bit louder. Now I'm ready for diaphragmatic excursion. So first I'm going to have her take a nice big deep breath and blow it out and hold it. Ready? Okay, take a breath. Hopefully that was not the change because of her sports bra. Okay, take another nice big deep breath and hold it. And relax. Okay, now on the other side. Nice deep breath and let it out and hold it out. Hold it in this time. Measure. We get about 4.5 on the right and about 4.5 on the left. Okay, now I'm going to turn you around. I'm going to do percussion on the front. Dull, resonant. Dull, resonant. So when we're doing lungs, we want to get between the ribs so we hear that resonance. I have resonance throughout, and I have to avoid the breast tissue. So I have resonance there. Okay, now I'm ready for auscultation. So first let me clean the stethoscope. And so first I'm just going to have you take a nice breath for me as I move my stethoscope from place to place. posterior to auscultation. So now I'm going to do the posterior. So this breath for me. Now if you could say 99 each time I'm in my sentence.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, now if you could say E each time I'm in my sentence.
E, 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 E.
Now if you could whisper 1, 2, 3. Okay, that concludes our lung assessment. Her lungs were clear. There were no adventitious sounds. They were symmetrical. The sounds were equal bilaterally. The 99, the voice sounds, the 99 and the E were symmetrical, and I couldn't hear the whisper 1, 2, 3 at all. Okay, so now we're ready for your cardiac assessment. So the first thing I did was elevate the bed, the head of the bed, to about 35 to 40 degrees. Put the side roll down so I can get to her. And I'm going to take the pillow out if that's okay with you, Megan, just for a little bit. And have you look to your left. And the first thing I'm going to do here is look for the pulse with my light. And it looks like the elevation is approximately there. So, and I'm going to take my ruler using the centimeter mark on the angle of Louis and come across at the top of the pulse, and I'm at about 2 centimeters. Okay. After that, my next piece is inspection, and I'm going to inspect over here. Are you okay? Which way should we? Which way do you want to go? Better if we had a sheet.
Oh, you want to get a sheet?
Yeah, we should cover her bottom. Okay, so I'm using my light to inspect for the apical impulse, which is often not visible, and I don't see it on Megan, which is normal. I'm right there, so I'm going to go ahead and palpate. Thank you very much. I'm going to palpate for the apical impulse, and it's not palpable. Now I'm just going to palpate for heaves and thrills on her precordium, and I don't feel anything. Now I'm going to go ahead and just palpate your carotids while I'm here, one at a time, so I don't make her pass out. Relax your neck. And they're symmetrical. I'm going to go ahead and listen for a bruit, which is at the bottom of the checklist, but I'm going to do it while I'm here,
Okay.
so I don't forget. So if I could just have you take a deep breath and hold it for me. Thank you. You can breathe. Now if you can look towards me, same thing. Take a deep breath and hold it. Thank you. Okay, there are no bruits heard. So now I'm ready for her cardiac assessment. And so I'm just going to listen in 5 different areas, okay? Sorry. First I'm listening in the aortic area. Then in the pulmonic. The second pulmonic area. tricuspid area, I'm just going to come from the bottom on that one. And the mitral. While we're here, I'm going to go ahead and take her pulse. We got 32 in 30 seconds, and so that's a 64 pulse, and the rate was regular. There were no abnormal heart sounds, no extra heart sounds, no extra heartbeats. S1 was louder than S2 at the apex down here, and S2 was louder than S1 up here at the base. Okay, so I think that concludes the cardiac exam. I'm going to move now into peripheral vascular. And so I'm looking at Megan's upper and lower extremities for things that tell me about her circulatory status. So first I'm going to look at her arms, and I notice that the color is symmetrical. Her temperature is symmetrical. Her skin turgor on both arms. She has no tenting, so she's well hydrated. I don't see any edema. I don't see any lesions at all, so that all looks good. Just put your hands here. I'm going to go ahead and check her pulses. Her radial pulses are symmetrical. Her ulnar pulses are symmetrical. Now I'm going to check her brachial pulses. Harder to feel, but they are also symmetrical. Great. Okay, now we're going to do the Allen's test, and so I'm going to include the ulnar and the radial pulse. And Megan, if you would pump your hand open and close. Okay, and now I'm going to release first the ulnar and then the radial, and I have immediate return for color. Now the same thing on the other hand. Okay, first the ulnar, then the radial. So my Allen's test is complete. Now I just need to check for her epitrochlear nodes, palpate, and I don't feel any on that side. Just relax a little bit here so I can palpate, and I don't feel any over here. Okay, so that's my upper piece of peripheral vascular. Now I'm going to come down to her lower body, and I'm going to uncover your legs if that's okay. Okay, so the first thing I'm looking at is on her legs is the color. It's symmetrical. It's summer. She's nice and tan. Her temperature is symmetrical. It's even. She has a scar on her left knee, right below her left knee on the inside. Her venous pattern, just rare superficial veins. I don't see any varicosities or any other problems there. It looks like she cut herself this morning. There's another little scrape over here. Her hair distribution is symmetrical even though she shaves her legs. Do you have any warmth?
No.
Do you have any warmth here? Okay. I'm going to go ahead and measure her calf circumference. It doesn't look like she has any edema, and she doesn't have any atrophy, but we're going to go ahead and check that out. So the first thing I'm going to do is measure her right calf. And it's about 37 centimeters. And then her left calf, and I know from doing my history that she's had some knee issues and some surgery over here, so it may be that this one is a little smaller, and it is. It's 36 centimeters, so just a slight difference there. So I think I've got everything on my inspection and palpation. I'm ready now to check for pulses. So her femoral pulses are right here. I'm not going to palpate those. Her popliteal pulses are behind her knees. And if I wanted to be more aggressive with finding those, I could have her lay on her stomach. I cannot feel them. And I can't feel that one either. I'm going to come down to her pedal pulses, which are nice and strong and symmetrical, and her pulses, her anterior tibial pulses, which are also nice and strong. And I realized that I left off something up here at the top. I forgot to look for capillary refill on her hands. She has very quick capillary refill, less than 2 seconds. I don't see any clubbing on her hands. On her toes, she also has good capillary refill and no clubbing. And I've actually looked at her legs, the color of her legs, while she was sitting up when I did her lung assessment, but I'm going to go ahead and have her just swing her legs over the side of the bed, right over there, just to get that piece done. And so indeed her leg color, while she's sitting, is also fine. Symmetrical, looks very good, even color, and I don't see any changes in edema or anything else. So that concludes my peripheral vascular assessment, I believe. My faculty can tell me if I got it all.
Yes.
All right, yay. Okay, so now it's the time in the checkoff to pick a system. Okay, so now we're ready to do skin, hair, and nails. I've already done all of my essential behaviors, and I'm continuing on an exam, so I don't have to go back and start over. I'm going to start head to toe. I'm not worried about her having any infestation, so I'm not going to use gloves. So I'm going to start with her hair. She has long brown hair. It's straight. It's full. The texture is smooth here. Checking for infestations. I want to make sure that I check in those nice, dark, warm areas behind the ears. Tilt your head over a little bit. Thank you. At the base of her head here and up on the crown of her head. Okay, looking at the scalp, and I see no infestations, and her hair is evenly distributed, so we're good there. So hair, now I'm looking at her skin. So the first thing I'm doing is looking for symmetry, and her skin color is symmetrical. She has a nice light tan, kind of olive skin tone. She has some freckles on her nose and on her cheeks from being out in the sun, probably. Yep. Her facial expressions are symmetrical. I'm looking at her arms coming down, her temperature, which I checked already, but her temperature is symmetrical. If I look at hydration, I did this also on peripheral vascular, but we'll do it again. Check up here. She has no tenting, so her skin is well hydrated. She has just an occasional freckle on her arms. I already mentioned on her legs she has this lesion here, which is approximately 5 to 6 centimeters long and about ½ centimeter wide. She has a little scar over here, just a couple of little cuts maybe that look like just from being outside. She has a mole. She has matching symmetrical moles, one on each side on the outside of her leg, and they don't look any different than they did earlier this summer or last spring when I did her last assessment. So I feel pretty good there. Okay, that's my skin assessment. Now my nail assessment, some of which I've already done in peripheral vascular, but we'll do it again. Her nails are smooth. The contour is smooth. She has a 160 nail base angle, so she has no clubbing. When I do her capillary refill, less than 2 seconds, really. Nice return. No clubbing there. I'm going to come down to her feet. She's got some polish on her feet, but again, when I blanch here, you can see that she's got good capillary refill and no clubbing on her toes. Also, her toenails, although painted, there's no irregularities or uneven waveforms or anything, no striae or anything there. So I'm done, I believe, with skin, hair, and nails. Yay! So now I'm getting ready to check a system from checkoff 2, and of course I'm hoping that I don't get anything but neuro. What do I get? Abdomen. Oh, sure. What a relief. lay down for abdomen, and I'm going to go ahead and put the bed up a little bit because that will make it easier for me when I'm looking for her liver. Is that comfortable, Megan? Okay, so for the abdomen, my order is going to be a little bit different. Usually I do inspection, palpation, percussion, and auscultation, but because on her abdomen I want to make sure that I don't disturb anything at all, I'm going to do inspection, auscultation, percussion, and I'm going to do palpation last. That way if she has any kind of mass that's uncomfortable and causes her pain, I'll still be able to do my assessment, and if we have any issue with bowel sounds, my poking around on her abdomen will not affect that at all. So the first thing I'm going to do is inspect the abdomen. I have good lighting here. I could use a pen light if needed, but I'm just going to look from the side. And her abdomen is flat. I can see some breathing movements. If I look really closely, I can see some vascular movements up here. Her umbilicus is midline, centered. She doesn't have any striae. She's got just a couple little dots like your heat rash. Okay, yeah. So that looks good. Everything looks good there. Symmetry, no other striae or anything else, so everything looks normal. Okay, so now I'm going to auscultate. It's the same patient. We've been together for a long time, so I don't need to clean my stethoscope again. It's a little cold. Sorry. I'm going to use a systematic pattern. And she has nice active bowel sounds in all 4 quadrants. I'll go ahead and see if I can hear any vascular sounds. And I could actually listen for vascular sounds down here as well. Okay, so everything sounds fine for auscultation. Next, I'm going to percuss, and so my hands are cold again. I have tympany throughout. Notice on percussion that my middle finger is flat against her stomach, and I'm using the middle finger over here as a hammer. If I want to amplify the sound so it's easier to hear, I can use a reflex hammer. Great tympany. It sounds just like a drum. Okay, so I have tympany throughout. Now I'm going to auscultate for the liver. I know that her liver is up here, so I'm going to move from tympany to dull up this way. So there's tympany. That sounds dull. I have my tape, but if I needed to, I could just have her hold it. And then coming from up here, I have resonance in her lungs. I'm going to measure her liver span in centimeters, and I get about 6 centimeters, which is within normal limits. So that's good. If I'm going from tympany to dull, hear the difference? That's the dull of the liver. Then here, that's resonance. That sounded different too, didn't it? So
It's the bottom part of it. That's right there.
Now I'm just going to percuss over here from tympani to dullness, which was right there. So that's her liver or her spleen over on this side for dullness. Okay. And let's see, auscultation, percussion, and I'm going to check her fluid wave. So I'm going to have her put her hand right here in the middle. I'm going to put my hand over here on your abdomen here, and I'm just going to give a little tap. And of course nothing happens because she has no fluid in her abdomen. But if she had fluid in her abdomen, when I gave that tap here, it would wave like the ocean yet. So I would see her hand roll, and then I would be able to feel the water touch my hand over there. So no fluid wave there. Okay, so the last thing on my list is palpation. So I'm going to start off very light. Tell me if it's uncomfortable. If it's hard for her to relax her abdomen, I can ask her to bend her knees a little bit. Can you bend your knees just a bit? You can put a pillow on her knees. But that she was pretty relaxed anyways, but that helps. Any pain?
No.
Okay, I don't feel any masses or anything, so now I'm going to do deep palpation, so I'm just going a little stronger. If she was uncomfortable with that, I could use this method with her helping me, and then, but she seems to be doing fine. No discomfort at all? No. Okay. There's her rectus muscles right there in the middle that I palpated on. Okay, so the palpation is fine. I don't feel any kind of masses. I'm going to try and palpate her liver. I have two ways that I can do that. The first one is from underneath here, underneath her rib cage. So I'm going to have her take a nice big deep breath and blow it out. Maybe I can just feel the slight edge on it. I'm not even sure, which is normal. It's normal for me not to be able to feel it. It's also normal to be able to feel a smooth edge. The other method I can use is the hooking technique. So if you'll, there we go. I felt like I got in farther the other way. I didn't feel anything that way. I don't palpate a spleen over here, so that's good. And the last thing we want to do is CVA tenderness. So I'm going to have you sit up. And let's see, you need to face the cameras. Your back needs to face the camera. Thank you very much, Megan. Okay, so I'm just going to put my hand here on the costovertebral angle and give a little pop. Any pain there?
Nope.
Okay, so I have negative CVA tenderness on both sides, and that concludes my abdomen exam. Hopefully I got it all. Yes, my instructor says I did. After the checkoff is complete, I've done my required systems, which was lungs and thorax, and then cardiovascular and peripheral vascular. Then I drew one system from checkoff 1 and one system from checkoff 2. Now, for the checkoff, if Megan and I were actually doing checkoffs together, we would change places, and I would be the patient, and she would be the nurse. And when we're both done with our checkoff, then we'll go into the conference room and we'll actually document what we did. So we'll only have to document on the systems that we actually assessed. Students are usually concerned that if you miss something, that's going to be really bad, but at the end of your checkoff, actually at the end of each system, we'll give you some hints about what you might have missed. Usually it's something as easy as take a look at your table is enough, and your equipment is enough to help you remember what you missed. You might have noticed that I actually missed a couple of things on my peripheral vascular assessment, but when I got down to her legs and her feet, I realized that I had not done capillary refill, and so I just went right back up and did it. And you are allowed to do that as well. Okay? I started with lungs and thorax, and I recommend that you start with lungs and thorax as well, because first of all, it's an easy system. It starts off with the landmarks, and usually it makes students feel very comfortable and relaxed. Once they get the landmarks going, it kind of jump starts it a little bit. You don't want to choose your system first, I don't think, because if you choose neuro, then you'll be very anxious. Okay, so that's the end of the checkoff, and I'll see you later for individual systems. Okay, so here we are, and we're continuing on with our assessment. I've already washed my hands. I've gathered all my equipment. I have privacy provided for in the lab. I have my stethoscope with me should I need it, and I've already done my health history, so we're ready to go. we're now doing the systems that I did not draw in my checkoff, but that I could have potentially drawn. So we're going to start with head, neck, and regional lymphatics. So the first thing I'm doing is inspection. And so when I look at Megan's head, oh, and I forgot to introduce myself, but she knows who I am. Okay. So the first thing I'm looking at is the size and shape of her head, and it is symmetrical, and it's the right size for her body. So I would say that it is normocephalic. Okay. I'm just going to go ahead and palpate her head. I don't feel any bumps or lumps or masses or any dings or anything there, so that's good. Now I'm going to come up here and palpate her temporal arteries, which feel fine. And can you open and close your jaw? Okay, and that feels fine too. And I'm going to step back a little bit and finish my inspection because I forgot to look at her face and say what I saw there. Okay, so when I look at her facial expression, she's smiling for me, so I can see that her smile is symmetric. Her eyebrows are symmetric. Can you frown for me? Okay, so her facial expressions are symmetric. There's no edema, there's no lesions, the color is symmetrical, and there's no involuntary tics or movements at all. Looking at her neck, I've actually already looked at her neck when I did respiratory, but I'm going to look again. I don't see any obvious masses or lesions. She's got good range of motion. Can you look to your right and then look to your left, and then can you put one ear to your shoulder either way? So she's got good range of motion that way. Okay, so now I'm going to go ahead back to my palpation. I did her temporal arteries. I did her temporal mandibular joint. There was no clicking there at all. Now I'm going to go to her lymph nodes. So I'm just palpating her preauricular, her postauricular, her occipital. I don't feel anything at all. That's good. Coming down this way, I have her cervical. If I go behind, there's her posterior cervical. If I go a little bit deeper, I have the deep cervical chain and the supraclavicular chain, and nothing is palpable there. If I come forward this way, I have, let's see, I did preauricular. Here's the jugulo-digastric, submandibular, and submental. And then going back to the salivary glands, her parotid glands are over here, kind of in her cheek area. Then she has these submandibular glands, salivary glands, and the sublingual glands as well. Okay, so I think I've got all of that. The next thing I'm looking at is her neck, and her trachea is midline. I'm going to go ahead and check her thyroid, and I'm just going to step around so I'm behind you, so I can check it from the back. Okay, so I'm going to have you tilt your head down and to the right a little bit. Okay, so I'm using my hands here to kind of displace the trachea, and then I'm palpating with my left hand. And can you take a just swallow for me? Okay, and then can you kind of tilt to the left? Same thing. Swallow. Okay, and her thyroid gland is not palpable. I'm going to go ahead and auscultate to make sure that there's not a bruit, although I don't expect there to be one since her gland was not palpable. And I'm using the bell of my stethoscope. And I don't hear anything at all, so no bruit. So here's our assessment for the eyes. Okay, our favorite system for checkoff one, right? Okay, so I'm just going to start with my inspection piece first. And when I look at Megan's eyes, I'm going to start with her eyebrows are symmetrical. They're are evenly distributed. There's no lesions. There's no edema. Coming down to her eyes themselves, again, they're set in her head symmetrically. They're not protruding. There's no lid lag. There's nothing. There's no swelling, either on the upper lids or on the lower lids. When I look at her eyelashes, they are evenly distributed, both top and bottom lashes. Okay, I'm just going to touch it a little bit. The conjunctiva are pink. Okay, the lacrimal apparatus, no swelling there. That's not palpable. She's got beautiful green eyes with just a touch of blue around the outside edges. The sclera and the cornea appear clear. Just going to look from the sides. Okay, so that's good. If I look at her pupillary size, her pupils are about 4 millimeters. So they're equal in size, they're round. I'm just going to shine this light. Got a deviated light. It's kind of odd. Okay, so I see constriction, and when I shine, I also see consensual constriction in the other eye. So my pupils are equal, round, reactive to light. I'm going to test accommodation. So if you'll just look at this pen light and follow it all the way in. Very good, that way. Okay, so now I'm going to go back up to the top of the checkoff sheet and do those other tests for the extraocular muscle control. So the first thing I'm going to do is the Hirschberg test, if I can get this actually to... It's weird. Okay. Okay, so I'm shining the light in the middle of her nose. There's the light right there. When you see it's reflected symmetrically in both eyes, so that tells me that her irises and her pupils are set symmetrically and her muscle movement is strong there. Now I'm going to test, that was the Hirschberg test. Now I'm going to do the cover-uncover test. So if you just keep looking at me, I'm going to cover and uncover, cover and uncover. Great. No strabismus, no nystagmus, no wandering eye at all. Now I'm going to have you look at something far away. So I'm going to cover, cover, and uncover. So there's my cover, uncover test. Now we're going to do one of our favorite tests, to test for peripheral vision. So we're both going to cover opposite eyes, but on the same side, okay? And so I want you to tell me when you see my fingers.
See.
She sees them before I do.
See. See. See.
Okay, now we're going to do this one. So obviously this
See.
test right here
See.
is only going to pick up
See.
very bad peripheral vision. Okay, this is what we call a gross test. It's only going to pick up really big discrepancies, and otherwise the only thing I can say now is that our peripheral vision is equal or better than my own. Okay, so that's the confrontation test. So now we're going to look at the diagnostic positions test. So I want you to keep your head facing forward, but follow with your eyes the pen light. And she has parallel movement in each of the cardinal positions. Excellent. Okay, so that's my extraocular muscle function test. Bless you. We did all of her inspections, so I feel good about that. We looked at the conjunctiva and the lacrimal apparatus. We looked at the sclera, at the cornea, clear. We looked at the pupils. We looked at light and accommodation and size. And so I believe we are now ready to do our ophthalmoscopic exam. So this is a brightly lit room, and so that's going to make it a little bit more difficult, but she has light-colored eyes, and so that's an advantage for me. So I'm going to place my hand over here first, just to make sure that I don't run into her eye with the scope. First, I'm going to find the red reflex, and then follow it in. Okay, great. And I can see some retinal vessels there. Okay, same thing on this side. Put my hand there. Find the red reflex. Follow it in, and again, I can see the retinal vessels and everything looks very clear. So that concludes the eye exam. Now we're ready for ear, nose, mouth, and throat. So I'm going to start with her ears. The first part of the ear exam is just inspection. And so I'm looking at the placement of her ears. They're in line with the outer canthus of both eyes, and they're symmetrical. They're not low set at all. Their shape is symmetrical. The pinna, the tragus, and the mastoid process. I'm going to go ahead and palpate. Any pain or tenderness? Nope. Okay. Any pain or tenderness? Nope. She's got piercings in both earlobes. The outer ear also I can see the external auditory canal. It doesn't look like there's any blockage on that part. So now we're going to do the whisper test. So I'm going to have you, push the tragus in and out, and then I'm going to whisper something to you.
1, 2, 3.
Okay, now we'll do the other side.
A, B, C.
Okay, so the whisper test is positive. She can hear fine without any difficulty. I think I'm ready for my otoscopic exam. So I'm going to make sure that I have a probe on, my light is on. I'm going to hold it up this way. I also want to hold my hand up here. I always want to make sure when I'm using the otoscope that I don't accidentally trip or get it too close in, because that would be very uncomfortable for her. So, and I can do damage. So I'm going to pull her earlobe or her ear up and back, insert the otoscope. There we go. There's that pearly gray membrane. And I can see the cone of light. I like the other ones better. Okay, that one a little harder to see until I pulled her ear back, but still I can see the tympanic membrane. It's pearly gray. You can see the cone of light. There is cilia and slight cerumen along the ear canal, the internal ear canal, which is perfectly normal. Okay, so that's done. Okay, so that was ears, so now I'm on nose. So her nose is right in the middle of her face where it's supposed to be. It looks symmetrical. I don't see any deviations at all. Doesn't look like you've ever had your nose broken, at least from the outside. I'm going to go ahead and just shine the light. Up here I don't see, this is a terrible light. Let's try this one. Okay, no deviations that are obvious from the external light. I'm going to go ahead and ask you to close one nair and take it and breathe. Very good. And the other one, and breathe. So both nairs are patent. I'm going to palpate her sinuses, frontal sinuses up here. Any pain?
Nope.
There. And then maxillary sinuses, any pain?
Nope.
There. So that's good. Now we're going to transilluminate. I'm placing the light here, but because we're in a light room, I have to cut my hand a little bit to get the transillumination. My light's not great. Open your mouth. And on this side. Okay, so I have good illumination on the frontal sinuses, a little harder on the maxillary sinuses. I think that's it for nose. Okay, so I'm going to go down to her mouth. Okay, so looking at her mouth on the outside, her lips they look nice and moist. Her facial expression is symmetrical. I'm going to ask you to open your mouth. So first I'm looking at her teeth. Her teeth are nice and straight. Looks like she has had some cavities in the past. She had braces. I can see that permanent retainer on the bottom. That's very good there. No caries or anything that I can see. I'm looking at her tongue. Can you stick your tongue out? And then can you lift it up? So I don't see anything there. I'm going to go ahead and use some gauze, if that's okay. Just to make sure that I don't see any kind of lesion on the back of her tongue. Okay, stick your tongue out. So I'm looking over this way, and I'm looking over that way. That's great. I don't see any lesions there. I'm going to look at the inside of her mouth. And I'm just going to use the light, if I can get the light to go in the right direction. There we go. It's low this time. Okay, so I'm looking at the sides. The buccal mucosa looks good. The palate is intact. Above, can you stick out your tongue and say ah? Okay, I don't even have to use the tongue blade at all. Okay, very good. I don't see her tonsils. Her uvula is midline, and it rises and falls. Her gums, I looked at her gums when I pulled out. Her gums are nice and pink. So let's see, I think we have everything, right? Outside, lips, inside, teeth, tongue. We did the sides of her mouth. We did the bottom of her mouth. We did the gums. We did the top, which is the palate. And we did the back of the throat, which is the uvula and the tonsils. Whew. Okay. Okay, so for musculoskeletal, I'm going to be looking at all of her joints from head to toe, and when I look at the joints, I'm going to inspect and I'm going to be palpating the joints. I'm looking for any swelling, any redness, any obvious masses or dislocations. I'm looking at the contour of the joint to see if there's anything that looks abnormal at all. I'm also going to be palpating. I'll be feeling for, again, edema or any atrophy, any pain, any discomfort, any masses, and then we'll be doing range of motion. I think I got it all. Okay, so we're going to start here on the bed first, and we're going to start with her neck. So if you could bring your chin down, and then back, and then if you could look to your right, and look to your left, and then touch each ear to your shoulder, which she's already done for me, and that was perfect, symmetrical. No problem with range of motion there. Any discomfort at all? I've already palpated and inspected her neck in a previous assessment, and I don't feel anything. Okay. The next thing we're going to do is look at her shoulders. Any pain or tenderness? I don't feel any edema there. So if you can raise your arms up and then put your hands behind your head and put your hands behind your back. And so that gets all of our range of motion for her shoulders. Now moving down to her elbows, which I've actually also palpated when I did peripheral vascular. No pain or tenderness there. Okay, if you will flex and then extend. And then if you can try and flex against resistance and then extend. Flex and extend. Great. Okay, symmetrical, equal strength on both sides. Now coming back down to her wrists. So if you can flex and extend, and your hands go in and they go out, and can you turn your palms up and then turn your palms down? Can you grip your hands like that? Can you grip my hand and this hand? So we have an open and close your fist. So we have equal strength on both sides. We're going to just do flexion against resistance and extension against resistance. And no pain or tenderness in any of these joints. I don't notice anything here. Okay, I'm going to go ahead and let's see. We're going to just check adduction and abduction with for your hips while you're sitting here, and then we'll move down to your knees and your feet, and we'll get the rest of your hips after you stand up. So if you can try and open, okay, and now if you can try and close, excellent. And if you can just open your knees and close your knees. Okay, great. And for your legs here, for your knees, can you extend? And can you flex? Great. And can you try against resistance? And can you flex against resistance? Excellent, excellent. Now coming down to her feet and her ankles, can you flex your feet and extend your feet? Can you make them go in? Make them go out? Excellent. Can you do that against resistance? And resistance here. Excellent. Now looking at her toes, can you move your toes up? And can you move your toes down? And can you push up against my fingers? And now push down against my fingers. I don't see any corns or calluses at all on her feet. So I think I've done what I need to do with her sitting down. So now I'm going to ask you to stand up. Okay. And you can use the bed for balance or the table for balance if you need to. So I'd like you to move your leg forward and then extend it back and, whoops, sorry, that way. And then can you take it out and then move it across your body? And now can you lift your knee up and rotate out that way? Perfect. Okay, and now let's see, we already did resistance with abduction and adduction, but I think I need to do resistance on extension and flexion. I can't really remember, so we're going to do it anyways. So if you could extend your leg, very good, and if you could flex back. Great. Okay, now if you can turn around, so you can do, or you could hold on to this if you wanted to, so you can do the other leg. So same thing, forward and back and out and across, and then bring your knee up and rotate it. Excellent. Okay, and now we're going to do against resistance there and resistance there, and we've already done the resistance for the adduction and the abduction. Okay, so I think that's it. We've done your shoulders, your elbows, your wrists, your hands, your hips. We did your knees, we did your ankles, we did your toes, so I think I'm ready for your back now. Isn't she a great patient? Okay, so the first thing I want to do is just palpate along the side. Is there any pain or tenderness when I do that?
No.
Okay, I don't feel any spasms. Okay, and then I'm just going to palpate the vertebrae. I don't feel any masses or spasms or anything there. No pain or tenderness there? Okay, great. I'm just looking at her posture, and she's standing up straight. If I can have you reach down and check your, or touch your toes. I'm looking here for symmetry, so there's no scoliosis, so that's great. Okay, stand up. If you could bend backwards, that's great. You can turn around now. So you see. If you could bend to the side and to this side, great. And can you rotate? And rotate that way. Okay, now we're going to do the neuro system, so I need my patient, Megan, to come and sit up here. Once again, this is just a continuation of our assessment, and so we've already done the things like I've washed my hands, I've gathered all my equipment, we've provided for privacy, I have gloves if I need them, and Megan and I know each other very well because we've been doing this together for a long time. So we're going to do a neurological assessment. So first, can you tell me what day is today?
August 2nd,
Great.
2016.
And where are we?
We are at Islander Regional Hospital, Texas A&M Corpus Christi.
Very good, very good. Okay, so the first thing we're going to do is test your cranial nerves. So I'm just going to ask you to close your eyes, and I'm going to give you a scent. I'm going to close one nostril, and then I'm going to give you something to smell, and we'll see if you can identify it. No, excellent. Okay, now we're going to do a different scent on the other nostril. Coffee. Excellent. Excellent. Okay, I've already actually done some of these tests in other systems, but we're going to do it again. If you would just follow, and she has parallel movement with her eyes, so that is excellent. I'm going to go ahead and right here just look for this light. Pointing down at your cheekbone there until I finally get the light in your eyes. We have constriction. The pupils are equal, round, reactive to light, and they do constrict, and we checked accommodation already, but we'll do it again. Okay. Now if you could smile and frown and try and lift your eyebrows. Very good. If you could blow, put some air in your cheeks and try and hold it in there. Excellent. I'm going to have you close your eyes, and I'm just going to touch your face with a cotton ball, and you'll just tell me when you feel it.
Feel. 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 Feel.
Great. Excellent. We've already done the whisper test with another assessment, but we're going to do it again. So if you wait, there you go. Yeah, perfect.
ADC. Graduation day.
Very, very good. If you could try and shrug your shoulders, great. And if you could push against my hand here, great. And if you could push against my hand here. Okay. We are not going to do the gag reflex. I've already looked at her throat, but we'll look again. If you can stick out your tongue and say, oh, I don't even need the tongue depressor. Great. Her uvula is midline, and it rises and falls. If you could stick your tongue out and move it around, great. And then if you can repeat after me, tight, light, and dynamite.
Tight, light, dynamite.
Okay, so that was the glossopharyngeal and the hypoglossal. I think we got them all. Okay, so now I'm going to move to gait. So the first thing I'm going to do is have you hop up off of the bed. I'm going to have you just stand still for a little bit with your eyes closed, and I'll be right next to you in case you feel dizzy at all. So it's the Romberg test for about 20 seconds. And she just has a slight sway, which is normal. Okay, great. Open your eyes. Okay, if you could walk towards the camera and then turn around and walk back. So she has a normal gait. Now if you could walk heel to toe. So that's her tandem walk. And heel to toe back the other way. And she's nice and steady that way. Excellent. Now if you could take your heel and just run it down. You want to hold on to me? Your shin. Okay, that's heel to shin. Excellent. And we're gonna run our fingers together like that. Okay, now I'd like you to touch your nose with a finger and then touch my finger. Okay, great. And then if you can just touch your nose to your finger. Excellent. Okay, so that concludes that piece of our exam. You can have a seat again. Okay, so now we want to test pain sensation without using anything too sharp. Okay, so this is going to be sharp, okay, and this is going to be dull. Okay, so if you just close your eyes and tell me if you feel sharp or dull.
Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Okay, now I'm going to go to your legs.
Dull. Sharp. 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 Dull.
Okay, great. Now we're going to do the light touch. We did that on your face, but we're going to do it again on your arms and your legs. So if you can just tell me when you feel it.
Now. 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 Now.
Excellent, thank you. Okay, let's see. Now we're going to do vibration. So again, just close your eyes, and I'm going to place the tuning fork on a bone, and you just tell me if you feel the vibration, okay?
Feel it. Feel it. Feel it.
No, that's because I hit that, sorry. My fault, I hit the sheet.
Feel it.
Okay, want to go to your knees?
Feel it. Feel it. Feel it. Feel it.
Okay, great. So that's vibration. Now, with your eyes closed, just put your hands out here. I'm just going to move your fingers either up or down, and I want you to tell me which way I'm moving them, okay?
Down. Up. Up. Down. 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 Up. Up.
Great. Same thing on your toes.
Up. Down. Up. Up.
Okay, excellent. Okay, so that's pain and light sensation and vibration and position. And so the last thing is, okay, so close your eyes. I'm going to put two objects. Give you an object, see if you can tell me what that is.
A key.
Okay, great. And can you tell me what that is? Perfect, okay. Now, Megan, we're going to see if this works. I'm going to try and draw something on your palm and see if you can tell me what it is. Okay, this is a number.
1.
Excellent. Okay, this is a letter.
Oh.
Perfect. Okay, now we are ready for reflexes. It's our last section on neuro. And so on the reflex section, I just want or your faculty will want to see that you know how to do them. You may or may not be successful in eliciting them. So I'm going to start first with the triceps. Okay, so this is not going to work. She has to be dead weight, or I have no chance at getting it. So I'm going right for the excellent dead weight. This is the triceps reflex. Now I'm going to do the brachial reflex. Again, she has to be dead weight, so my thumb is right here on that tendon. Dead weight again. There's the tendon. Not as obvious here, but I could feel it there. Okay, now we have these, this brachial radialis, which is a little harder. Let's see. And the book shows that we can also try and do it this way. Relax. Is that
No, that was really.
That's okay, so awesome. So I got it on this side, but I didn't get it on this side. And so I'm just going to document that I could not elicit it on the left, but I elicited it on the right. We're not going to keep poking her. Okay, now we're going down to her quadriceps reflexes, and let's see if I can do it standing on this side so the camera. Does that work? Okay, so sometimes people have a hard time relaxing enough, so I'm just going to have her do an opposite contraction on another body part, so I can just relax. come around this side here. So her reflex on this side is a little bit diminished, which is consistent with how it's been, right? Okay, so I still need to do clonus, and so I'm just gonna relax. I'm just gonna do this reflex again, so I know that she's relaxed, and then she has no clonus there. And relax here. A little bit, no clonus there. So she has no clonus, and the last thing would be the plantar reflex, which I am not gonna do because it feels kind of creepy, but I'm just gonna show you how you can do it. You can take this part and draw an upside down J on either foot, and her toes should curl, like so. A baby's toes would fan, an adult's toes should curl. If her toes fan, we're in big trouble. Okay, I think that's it. Did I get it all, Deanna?
Yes, ma'am.
I've completed my checkoff with all the systems, and I feel a big, huge sense of relief. I'm all done. This is great preparation for my HESI exam, and my checkoff score is really going to bump my grade up, so hopefully I'm going to get an A. Hopefully this will be very helpful for your preparation for your checkoff. And the last piece of advice, which we'll give you again in person, is just to take a nice big deep breath and relax before you start, and you'll be fine, as long as you've prepared. If you have not prepared, it will not go well.